Hello, welcome to
Hello.
Timisoara.
Hi everyone. My name is Alla Korolevska and my project Ukraine is for Ukrainians and Ukrainians are for Ukraine is starting and it is continuing. And now I would like to present you my real friend, my colleague, the surgeon. I could say that it is an international person. Why do you think so?
So,
It is
hi
Edward
everybody.
Sujic.
Hi everybody.
Could you
Thank
explain,
you, Alla, for this invitation. I support everybody, and I'm with you in Ukraine, of course. So I met Alla in 2017 in Vienna, where I was a surgeon. No, where I am a surgeon, and we met at the Rudolf Stiftung, and in a big hospital in Vienna. So afterwards, nobody expected what happened in Ukraine. We are all sorry for this, and we didn't expect anything to happen. It was a normal collaboration between academics, and suddenly this interaction broke because of the war. But we did our best, and now Alla joined me here in Timisoara, in my hometown in Romania, and we are trying to do together a project for helping Ukrainians. So she is the main character here. About me, so I left Romania. I studied in Romania, in Timisoara, in the university here, and I left for residency in Germany, where I learned about surgery and about opening abdomens of people and fixing cancers and something like that. Afterwards, my career put me in the field of investigative surgery. Investigative surgery means doing a lot of research. I landed in Vienna, where I performed also all kinds of surgeries, but for a special endocrine surgery. So this is about thyroid glands, about glands. Yeah? And the problem is this kind of surgery is very complex.
Any kind of surgery,
Any kind of surgery is very complex
if
you start to explain this. But I'm happy to perform in this project together with Alla, and thank you for the invitation.
I'm very happy to know you.
Thanks.
Sorry to say it, but it is really from the soul. It is like that. And if we come back to my idea,
Yeah.
I would like to ask you sincerely and to be open for the students, for the person who would like to become some kind of specialty, not just to be a surgeon.
Yeah.
For the students, if you would like to become some kind of specialty, if you would like to become a very good specialist, what do you need to perform?
3 things: navigate, operate, communicate.
But if you are not a surgeon,
I cannot imagine that I'm not a surgeon. So the
But
only
what
thing I
about the
imagine about surgery
surgeries?
about medicine, I can imagine is doing surgery. So I can only wish every one of you to become surgeons. So I cannot be. Of course, there are many disciplines. So I respect. First of all, the internal medicine. It's very complicated. So surgery is very simple. You have to operate, to navigate through the body, and to communicate your decisions.
to understand.
And if you are true with yourself and do not do a passion about it, but just take the right decision. So what I did in my life, I have many more passions. So for example, I have sports I do not, but I'm piloting planes and I'm doing music, and this is passions. But surgery doesn't have to be a passion. It has to be done correctly, because a passion you're doing for yourself, and the surgery you're doing for the patient. That's why I don't want you to become passionate surgeons, but correct surgeons.
Yes, it is great to be healthy.
It's good to be healthy. Yeah?
Yes, but
Surgery is
not
about
so
blood and fecals, you know. It's not a nice job. It's
But
not a
it
nice
is-
job, but
it
it's
is-
a
life
it is
is
a very,
life.
very, very, very interesting job, but it's not a light job. And if you cannot do it with consistency, you better leave it.
But anyway, if we come back to our life experience,
Yeah.
our education experience, to become a good specialty,
Yeah.
not specialty, specialist,
Yes.
we need to have the experience. And
Some
if
qualities.
we want to get this kind of specialty level, we need at first to understand. And
You have to
for me,
understand
step by
chemistry.
step, yes, step by step.
You have to
perform.
understand physics,
Yes.
and you have to understand biology. And if you understand these three matters,
Yes. And
Um,
as for me, it is also very, very important to have the experience to test everything, no matter where. And I had such experience. I was lucky, and I know that you was lucky, much more luckier than I, because you had experience in few countries.
Yes.
It was Romania, it
It was-
was Austria, it was Germany.
and friends.
What else?
Friends.
France.
Yes.
And by the way, you had got the very good position at this moment. You few steps of experience.
Yeah.
And
It's
now-
interesting. I managed to become chief of surgery in all these countries, you know.
Yes.
But it's difficult to stay somewhere. It's because the surgeon's soul is very difficult.
I know.
It's a difficult. We are difficult kind of persons.
Yes,
We are
because,
open-minded, very open-minded.
Because
but
we have the
we are
clear
very difficult to
construction
satisfy.
of that, yes.
We are very difficult to satisfy. And I think you have to put your stakes high. Put your stakes high and try to become top on top. Because if you don't, you will lose your power of decision.
And somehow
You have to think big. Think big and try to get there. Okay, what do you make if you are there, like me? Put it all together and try again in a new place.
What I don't know. I have my own experience. When I had got the top
Yeah.
of my idea, I had got the result.
And then it's over.
That's over.
Yeah,
What
I have
do you do?
to I start again.
The same.
I start again in a new country, for example.
I was a little bit confused because I had such experience during.
I'm not the best example about keeping the stakes. Yeah?
But I can
got them
tell.
and I lost them because I let the other people do their job. I became chief of clinics and said, okay, for me it's enough. Maybe I like the sports to get the first place.
It's enough for you.
But yeah, for me it's enough.
I'm not sure because I'm also the surgeon. I know.
Okay, maybe you're right.
Sincerely, because I know that I will try to explain a little bit in a different way because you are the surgeon and you are a very famous surgeon in our families. I cannot compare because it could not be compared. We are just perform our work in the best way what we can do.
We can do well.
We are always trying to find the best solution for that. We are trying to get the best result for that, and we are in the best position because we could be fired for.
Yeah.
We could be a person. We are the persons for sure that. Because we have this kind of experience when we could get few propositions by the same vein to work in different countries, and we are the persons who could decide.
You know why we can work in different countries and it's open for all surgeons? because in all countries the surgeons operate with knives,
Yes.
coagulate with
scalpel.
heat, and stitch with needles. It's the
Yes,
same
but
thing
it is-
everywhere.
But it is not enough.
It's enough.
No.
It's the same
No.
procedure
No.
everywhere.
No. If you are not able, if you are not experienced,
And experience comes with what is experience? This is a thing what you know what experience is?
I know.
Experience, or to be wise in surgery means that you had a lot of negative situations. So
Yes,
we
but
learn from
anyway-
negative situations, but in surgery it's very important to learn from the experience of others.
if you don't
So
have
learn.
if you don't have negative situations, you could not become a good surgery.
No, because
specialty.
it means you didn't work enough.
Yes, yes, for sure it is like that, and
But important is to make in surgery described operations. So operations which are described, because if you make operations which are not described, you have complications which are not described, and then you have a big problem. So if you listen to the books and do it step by step by checklists like flying an airplane, you will not have situations which are not controllable.
yes, of course.
And that's what I want to bring over, because I have experience also of a pilot, a professional pilot. I made 2 jobs. In surgery, you have to have checklists like our airplanes, because our airplanes don't fall from the sky. Sorry, as often as patients die in surgery. I think the surgeons have to rethink their decision making algorithm. Yeah?
Yes.
It's very important.
And I could say about my experience, I'm very lucky person because I had a very cool teacher such as Professor Savi, you know him.
Yes, of course.
And one of part of my work, my research was complications, decisions.
Decisions and management.
And management, yes. And the biggest mistake, as for me, as for my opinion,
Yeah.
I don't tell that it must be like spoken aloud.
Yeah.
But it must be, because it is the greatest way to find the decision for all such things, like a complication, because just complications as a result of our work could be the sign, could be the mark or the assessment of our work. Surgical work, not just surgical, but for
No,
everyone.
just the patient management. Yeah.
Patients management. And
Yeah.
we discussed with Professor Savi. He is a very nice surgeon, you know him.
I
We
know
worked
him
with
personally,
him
yes.
also in a
I
patient
can imagine.
theater,
I can
yes.
remember how we operated together in Vienna,
yes, yes.
a thyroid. So I operated. He assisted me. I showed him a new kind of instrument. He was very nice, impressed. We had a very good time then.
Because
but
we
it was
are
no
very,
war.
our mind, we are maybe a little bit different people because we are very open with our minds. And somehow I am very lucky because we started to discuss with him about complications, to start to learn it, to understand it, how could we manage it, how could we make the better treatment of the complications and the best to make the prevention of
Yeah.
this kind of complications.
But
And
I
we
think
make
preventing complications is
the main task.
the main issue of surgery.
Yes, the main
Okay,
task of surgery.
healing of the
Yes,
patient is the
yes,
main.
yes.
But preventing complications, you cannot prevent every complication. But if you do, like I said, it's my opinion. If you do operations which are described in books, or which are let's say. How should I say
Explained
it? Not
in
explained.
some,
It's evidence confirmed, yeah, by evidence. these operations will provide you, of course, in some kind of percentage with complications. But these complications are also described, so you
Yes.
can manage them. You can expect, for example, if you land a plane without flaps, to have a long landing line, not something else.
But
If you do a midline suture with the peritoneum, you have to expect that it's gonna be exudation, because you don't have to stitch the peritoneum. It's simple. So the rules are simple, and the rules in surgery are rules.
yes,
There are no rules,
But-
it's rules.
but I need to notice. Sorry, I am just a woman at this moment.
No,
just
no.
a coach.
No.
Is it okay?
For me, it's everything is okay.
Do you remember yourself when you was a student?
Yes, I remember.
Really?
I didn't think,
And
I didn't thought that surgery. I thought it's more complicated than it actually is, but
and,
it
I
is.
had the same.
It is simpler that it actually promoted. So it's actually performing by rules makes you sleep good. And the most important thing for a surgeon is to sleep well at night.
Somehow
to be-
it was like that.
Yep.
And if I discuss about myself, I was surprised that when I became to surgery specialty, and when I came back to my students' years, students' surgery course, I remember that I was shocked that we had something like slide,
Yeah.
light, very easy and understandable, and I understood that it could be not so easy like it was in the book described in the book. Especially when I had my own experience in Austria surgery department in Rudolf Stiftung in 2003.
Yeah.
And I was a participator in surgery. I was surprised how could it be. I was shocked at first. And as for me, the students must take participations, no matter would they like
Or
or
not.
not like to become a surgery specialty. If he or she would like to become a doctor specialty, he needs to know the basic
Basic rules.
rules,
Of
basic
surgery.
knowledge, no matter surgery, surgery.
Of biology, of medicine.
Yes, everything, especially surgery, because we have the friends, we have the family, we have somebody else outside who will tell you one day, if you are not even the surgeon, you are the doctor. You
Yeah.
must know.
First, you have to be a doctor and
Yes,
then a
you
surgeon.
have to
You
be-
are right.
Yes.
You are
And
right.
it is the biggest trouble, especially somebody will call to me and, but you as a doctor, you must know the
Physiopathology, you don't know.
yeah, something like
Dermatology, you have
pathological
everything.
issues or something like that. If we come back to my idea, I wanted to discuss with you about your own project, about your idea to perform international institution. I think you will. You are able to explain it much more better than I, because it is from your soul, from your idea.
So, I think, like I said, surgery is performed by the same instruments all worldwide.
Yes.
We have different languages and have different experiences. But in the operation theater, like we operated, me for example, Professor Savi, we understood each other without speaking.
Yes, because we just walk.
We do the same job,
Yes,
and I liked it
yes,
because I have a different school than him. I have a different school than you, but you have a good school and I had a good school, because this is about understanding. I can come to Ukraine and operate exactly the same way,
Continuous
like here or
surgery.
or in Austria,
No matter where.
no matter where.
Romania.
No matter where, no.
Germany.
It's the same.
USA, Great
Of course, the
Britain.
systems, the administrative
Yes,
system
yes,
is other,
yes. It is very big.
This is a problem for surgeons because we don't write very. We are not in love with writing.
I had with my friend, he is not my just my friend. He is my partner. He is my man. He told me one day something like, "I am very happy that we have the clear rules on the road
Yeah.
for whole world. The same.
It's all work.
It is the same in surgery,
is
not
the
just
same.
on the road.
No,
not
it's-
for the just for the
Exactly.
after.
Not only. For example, planes fly one day from America to Australia. They cross about 50 countries. And it's the same rules. Why do they do not fall down? Because they're respecting the rules.
And I wanted to ask you, could you explain me and our audience about your international project for surgery? Maybe not just for the surgery.
So maybe
for
I
medicine.
make it short.
Yes.
We will find a way to bring some students from Ukraine to Romania or to Vienna or to Germany, depending on what their interest it is, to help them to see how the work is. So we are trying to implement a project, a European project, because we see Ukraine as a European country, and I think you have the right to have access to all the countries and all the systems to know how they work. Because first of all, a doctor has to understand that he is a part of a system. So when I left Romania, I thought I left the system, yeah? Because we are communists. I left the system, but this is not good. You know, it's not good because I tried to be outside of the system and I was wrong. We have to adapt through different kind of, I think, different system. And if you cannot adapt and do not know the systems, your tendency is to not negotiate, just push it away. And that was my experience in life. Yeah? I tried to push away the system from me, not me to get attracted by the system. I tried to say, because such I reacted. I don't know why, but I was wrong. So important in life is to say what you were wrong, also not what you were right. And this experience I want to share, and that's why also my good points, yeah, the absolutely top medicine in Essen, absolutely top thyroid surgery in Uldor-Stiftung, to share with other students who want to do this. But also my negative experience too, like I said, yeah.
But anyway, try to, as for me, we have the main rule in our life to understand ourselves. What do you want at first? What is your primary
Yes.
dream?
But this becomes a psychiatric discussion now. And
Psychiatric,
it's not
not
about surgery,
psychological.
it's psychological. I'm not. You know, as a surgeon, you have to be your own psychiatrist. That's why I said this. We have to be our own psychiatrist. But it's very interesting that we come here together, and I want to support you in all your projects. And I think we will come together, and in many other interviews or many live sessions, I will support you, and maybe we'll have discussions with your students.
I
I
would
think it's
like
okay.
to have idea that we will find the results, and it was the main idea of this project.
Yes.
And at this moment, I wanted to ask you sincerely and to be open for your
So
soul.
this is. You know, when somebody asks me, if somebody asks you if you want to get married directly, you
No,
know.
I will think about later. And at this moment, even
I'm getting
much,
a little bit.
I
Sorry.
have to say, sorry. But sincerely, and to be open, to come back to our childhood. Did you think so that you will become to that position as you have now? About what did you dream?
I didn't dream that I will become president or king, for sure, and that's why I didn't become. I dreamed about becoming a tractor driver for the farming. I did dream about becoming a pilot or soldiering. You know, when we solder together irons. That was my three dreams. One of them, two of them become true. I cannot soldier.
Somehow
for tractor.
I was also the child as you, and we have the same dreams. And at this point, we are older, and we have some dreams also. And we can tell that it is, if we come back to our childhood,
Exactly.
what would you like to tell to yourself
I think
when you
don't
was 5
try.
years?
No, to myself nothing. I don't have
Nothing?
to. Nothing.
Are you
Nothing.
serious?
For a child, no. I was innocent.
Okay,
Look at
when
me.
you was
I'm
young.
innocent. No, when I was adult, I have to deal with some issues. But as a child, I am happy that I didn't dream to become a king. I am not. Many children in our group said, "I want to be the king," or many. I want to be the princess.
Did you dream to be a happy
Happy.
or success?
What was in childhood, which we didn't
it
know
was,
what happiness is. It was happy.
Maybe
So I didn't.
something, another understanding of happiness.
Interesting. When I was a child, there was communism, yeah, and I said because I hated it because my parents hated it.
Yes, I
I
had the
had
same
a small,
experience.
small television in white and black, yeah, and I said, if in year 2000 Ceausescu will still be in Timișoara, in Romania, I will put this TV on the garbage, and it didn't happen. It was 1990, and it disappeared. So I still have this TV.
I have some very special question to you. If you have some favorite student, really favorite, which you would like, for which you would wish the best future, what do you recommend for him or her?
If I would have a very interesting student, which I would love, I would put him maybe in the position which I had. So I will stress him as much as I can to do the best and more that he can, because I think he can do more than he can. Of course, he would have no expectations from me, because I know he can do this. And he has to be the best then. I don't want to make him a leader or don't want to give him the first prize. No, he will be the last on the list.
As
Sorry,
for
this
me-
is why.
But as for me, I know the both positions of this kind. I mean, to be the students and to be the teachers. I have the same wish, and somehow I would like.
I would like to
support.
help the
And
students
maybe
which are not the best. You know, this is a professor who has to help the students which are the best. The best ones are the last ones. They should clean
go
clean.
ahead, to
The
go ahead. And,
best ones should clean the.
Yes, but the first
Yeah.
step it is just to clean, to
Just to clean.
understand,
To understand.
what does it mean, what
clean
will
the
be
operation
next?
room.
Yes, what will be the
To
next
clean the
step?
patient,
Yes,
to work as
yes,
a
yes.
infirmary, to work
And,
as assistant,
as
as
for
assistant,
me-
to
as
do
for
the
me,
basics, to put
especially-
infusions,
Yes.
to do the paperwork, because I didn't like the paperwork, so I don't like it today neither. So, but I
was
had to do it.
surprised with my experience of to be a teacher when I had got the possibility to take care about the students, about their skills.
Yeah.
I was surprised, especially after the COVID infections, after the online
Pandemic.
classes. The students during 1 year did not have the practical skills, and we had got the possibility to make check-up of that. I was surprised they did not have experience to take care about some injections. They did not have
the
possibility.
skills to do intramuscular injections.
Even that, they did not. They were surprised even to take the syringe.
The syringe out of the package. Yeah.
I was surprised. They did not know how to push out.
So you know
how
there
to
is two
connect,
kinds of medicine,
the
two kinds of
needle and
two kinds of
the very
a practical
simple,
and a theoretical medicine. Yeah.
very simple issues, and I was surprised. I did not know how to support them to get the mark for
Yeah.
this kind of practical issues, these practical skills. I did not know how to support them because they must do it. They are already.
Okay, Ala, I know what you're talking about. That's the conclusion is I want to support it. Like I said, the one who does know in the clinical field how to manage the patient is the one who will have no stress afterwards. The ones who don't know how to pick up a syringe will be stressed in medicine.
Yes.
And that's why I am very, how should I say, I find it very important for having a skills lab in the university as a discipline, because there you can do the trial between theoreticians and practical
It is
medicine.
a little bit different because everyone could imagine everything what they or he or she, no matter who,
Yeah.
will read in the book. And
Yes,
it
of
is a
course.
little bit
There
different.
are many professors or chief of clinics. I visited so many countries, which because of the titles they become chefs, but they cannot change a tire of the car. You know what I mean?
Yes.
They
of
cannot
course,
change the
because-
tire of a car, but are professors.
Yes,
of surgery,
yes. It
of
is,
surgery.
Yes,
It's
and
not normal.
it is a big
This
trouble
is not
in
normal.
whole world, not just in our discussion issues. It is we could find it everywhere, no matter in which country. That it is a big problem that the people had got some titles, but they are not able to perform something practical.
Practical skills. They don't have skills.
Yes.
And that's why I
And,
think we should do this together, performing a skills lab. After maybe as a collaboration between universities and only as our project. Yeah,
But don't you agree that
we could influence the people in this direction.
Yes.
But attention, these people, which have many papers and cannot change a tire, won't listen to us. They won't listen to us. They
But,
will say
we
we
are
are
different
stupid. We are stupid, and they will become our chiefs.
What about if we come back to yourself, your personality, and my personality?
I think we are
different.
both extruding
Extra-
personalities.
Extraordinary.
Extraordinary personalities.
Because
You
we
are
have
extraordinary.
both experience
But,
to be skilled
we are
and to be
ex-
published,
yeah,
to have experience
public.
in.
Yeah.
Yes, we are public people.
I think
And,
we should do this.
In my mind, I have some great idea. Maybe not great, but it is my own idea from the soul to
That is a
support
great
some
idea.
students to become a very good specialist in practical skills. And I know it is from Professor Hook. You know him.
Yeah.
He is a surgeon from Austria who
Yeah.
is a presenter of Ukrainian people, of Ukraine totally,
Yeah.
generally.
It's not only the problem of Ukraine; it's the problem of the world. But
It's for the whole world.
now you are in the
I just at this moment I am presenter of Ukraine because I
Yes.
am Ukrainian. It is my
obviously.
yes, it is like that, and I'm happy about I am Ukrainian. And somehow I would like I would like to be a person who will support the Ukrainian students, no matter will it be just the student from Ukraine.
Yeah.
Natively, or will it be the foreign students
Okay.
to have some practice somewhere else in Europe, in America, in Australia, in China, somewhere else. What would they
Need.
prefer or mean? And I know that you have some international project.
Yeah.
I would like to hear about it from you.
Yeah. So I have an international project about international surgery and international teaching. Because my decision to go out of a country and to visit many countries was a good one. It was not actually only my decision. I was discussing it, and actually I was helped by my father, who was a great surgeon, and he's now in pension, but he was a great surgeon. And he said, "Boy, if you want to have experience and to be above me, you have to go away. You have to see other countries, you have to see other systems, and you have to see how others work." And that's why I promote this idea now. And no, I made it for myself. Okay, maybe too many countries, but
Too many. Maybe not enough anyway.
maybe not enough. Okay, we can travel together to other
With
countries. yeah.
Ukraine, it was not included.
Ukraine was not included. Yeah. But
Excuse me.
sorry, but I'm not able to come now to Ukraine. I think it's not
We
possible.
will do it.
But
in
do
the
you do
future,
it?
maybe.
I'm sure.
I hope so.
I'm sure. And we actually do this project as an international project for students. We choose every 3 students from the best, or about our criteria, and they get to work in one institution in Germany, then in Austria, then in Romania. They make an exchange. So my idea is in 1 year they should exchange 3 countries
During the year.
during the year.
Okay, it must be something like a practice during the year. For example, 1 week in Austria, 1
No,
week.
3 months, 3 months, 3 months. Because
Uh,
1 week is not enough. You cannot understand anything.
But officially, it is a little bit difficult.
No, it's very difficult for the soul. Because if you have 1 week
officially.
only, 1 week only, listen to me. If you
Okay.
have 1 week only, you don't get excited too much. So you don't get
I
integrated.
agree.
And then you said, okay, next week I will be, forget it. And it will be so.
I mean,
But 3 months to stay in one place, you have to drink, you have to eat, you have to know people,
To understand
and
to
then
be,
break it
Yes.
and go to another country. And when it's most difficult to go away, it's on the 3rd month. Like gravidity. On the 3rd month is the difficult,
Yes,
you know.
but maybe it is difficult for official way because
The official way
students
in
have
Europe.
9
No.
But in Ukraine also
I want to
months,
put them in a difficult situation, you know. Surgery sometimes put you in difficult situations. So I will train them for this.
I
You know,
understand
my
because
training for surgery was dealing with difficult situations.
I know because
For
I
piloting was dealing with difficult situations. What should I learn them? Dealing with difficult situations. So, you
I-
like Austria? Go away.
I know this situation because I was a nurse during a few years when I was a student, and it was really something like it is necessary to be in time everywhere by the same time, and it is really a good deal to find solution for that way. But for 3 months, for me, it is something like unbelievable. It is like impossible. 3 months here, 3 months here, and 3 months there.
Why? Of course, you look like 21, but you are not 21. You know,
I am also, of course,
30. Yeah.
my daughter is 16
Yeah,
years
you are
old. I
30
could
now.
not be 21.
No, 21. But we are talking about 22-year students. Yeah. And the problem, I think, this is my proposal. So if you agree or not,
Okay.
I want to put them in difficult situations, and I want to
could
prepare
we-
them for surgery.
Okay, could we invite some student from Ukraine, no matter from Ukrainian institution?
3
Three.
students
Uh,
to do this rotation.
this kind of rotation.
Yep.
Okay, anyway, at this moment during the war, we have online classes which could be watched even after, later, not in time, not online. I think it could be
Why?
possible.
You know why? You know what this is your task to. I will organize the clinical part, and you have to organize the part of communicating this with the other students, because the ambassadors of our project are these students, and they have to bring it to the other ones. What their experience is.
For sure, these 3 students,
Will be the ambassadors of Ukraine.
yes, and I am sure, I know by my mind, by my opinion, my soul, that these students are students who would like to become a surgery specialty. This is the task number 1.
Okay, this
And,
we'll
I
decide
think
together. No, they want
The
to
main
become.
task for is the decision from them
Of course.
to become this surgery
Yeah.
specialty, not from
They have
us.
to tell me why. For you.
This is the big task, the decision. Just after decision
Yeah.
to make the goal, the aim, it is possible to step by step perform it. And just after that, we could become you and I for that. And I think we could ask the students, please, if you would like to become a surgery specialty, if you would like to have the international practice in Romania, in Austria, in Germany, please send us the message directly, and we will discuss, we will continue to discuss about the possibility. We will try to perform all papers to make it, and I know, I am sure that it will be done. I
Yeah.
wanted to ask you.
If you make the papers. No, of
No,
course,
it's
of course.
possible.
No, it's
No,
of course
it's
it's
possible.
possible. And it's a
Everything is possible in our life.
it's a nice project. And I think the students deserve this. And they have to know what really European means. You know, maybe I dreamt of Europe. You know, I was communist here.
Yes.
Communist times. We had also a revolution, not a war, but a revolution. And I dreamt of Europe, yeah? Like Europe is, you have to see it by yourself. That's why 3 countries, not Germany is the best, not Austria is the best, or not Romania is the
But
best.
from which every country
You
we
have to
could
take
find,
something.
Something.
Because the
Yes.
schools of medicine are different
Yes.
in different
I
countries.
know it because I had the different schools.
So good luck to everybody. Thank
We
you for
will
your
continue
invitation.
and
We will
we are
continue in
waiting.
another
Yes.
episode.
Yes.
Thank
Thank you
you.
very much. We will continue. I hope to see you next time.
Yeah.
And I am waiting for the comments, for the proposition, for the advice, and I am waiting for the 3 best students who would like to become a surgery specialty. No
Good luck.
matter where. Good luck.
And like
are
we
waiting
say
for
here,
you.
Slava Ukraine.
Слава Україні! Героям слава!